Hello, I'm Ryan Tucker, Emergency Ultrasound Fellow at Denver Health. Today we're going to talk about the femoral nerve and fascia iliaca blocks. I have no disclosures. The femoral nerve and fascia iliaca blocks provide analgesia to the hip, thigh, and medial leg. There are about 500,000 hip fractures annually in the United States. Femoral nerve and fascia iliaca blocks can be safely performed by EM physicians, and we have data from randomized controlled studies that show that these blocks can decrease opiate use while in the hospital. They can decrease the incidence of complications like pneumonia, and they can also improve long-term functional outcomes for patients. Shown here is the probe positioning needed to identify the anatomy to perform this block. The probe is placed transversely in the femoral crease. You can start just inferior to the anterior superior iliac spine and trace medially. You can look for the large vessel landmarks that you are familiar with from performing central lines in the femoral vein. Trace the femoral artery proximally and distally in an attempt to identify the bifurcation of the femoral artery. You may see the femoral nerve just medial to the femoral artery. This still image shows all the important structures you need to recognize before attempting this block. We see the femoral vein outlined in blue here being most medial. Just lateral to that, you see the femoral artery, and just lateral to that, we can see the femoral nerve. The fascia iliaca, outlined in gray here, is a fascial plane that drapes over the top of the femoral artery. This video shows the scanning technique. Once you identify the femoral artery, you can scan proximal to distal along its course to identify the bifurcation. The femoral vein is medial, and this vessel should be compressible. The femoral nerve is just lateral to the artery shown here. The patient is placed supine in order to perform this procedure. The ultrasound should be placed on the opposite side of the affected leg. The probe is placed transversely as shown here. The needle is inserted just lateral to the border of the probe and is advanced using a in-plane technique medially towards the target nerve. While the scanning technique, as well as the anatomy and the approach to the block procedure, are similar for the femoral nerve block and the fascia iliaca block, there are subtle differences in the procedures. First, we will discuss the femoral nerve block procedure. To perform the femoral nerve block, the needle is advanced from lateral to medial using an in-plane technique shown here. You should feel a pop or a decrease in resistance as you pass through the fascia iliaca. The target for your needle tip is shown here in this orange star, which is just lateral and deep to the femoral nerve. This is a video clip of this nerve block procedure being performed. You can see that the provider is advancing the needle in an in-plane approach. Here you can see the tip of the needle just inferior to the fascia iliaca, which can be identified here. It may help to inject small amounts of anesthetic, being shown here, to define exactly where the tip of the needle is located. The provider here is advancing to this space, which is just lateral to the femoral nerve. The femoral nerve is shown here. And once the needle tip is placed in this location, injection should result in hypoechoic anesthetic surrounding the femoral nerve. Next, we will talk about the fascia iliaca block procedure. The fascia iliaca block technique is very similar to the femoral nerve block. You are advancing the needle from lateral to medial, as shown here. The difference is your target. When using the fascia iliaca technique, your target is the potential space that is just deep to the fascia iliaca. The fascia iliaca is shown here, outlined in white, and your target is depicted in this orange star. In this video, we see the fascia iliaca block being performed. The goal is to position the needle just deep to the plane of the fascia iliaca. As you see here, the first attempt at injection resulted in filling of anesthetic just superficial to the fascia iliaca. The provider here pulled back the needle and is re-advancing in an attempt to place the needle tip just deep to that fascial plane. You see here the shaft of the needle as it's being repositioned, and the tip is being placed here, and so injection is resulting in a lifting of the fascia iliaca, and injecting anesthetic here will achieve a good block. To achieve an effective block for both the femoral nerve block technique as well as the fascia iliaca block technique, volumes of 10 to 30 cc's of anesthetic is needed. A long-acting anesthetic like ropivacaine or bupivacaine will provide a long-acting analgesia and allow time for surgical management of hip fractures, and this will bridge the patient to possible other block techniques performed by anesthesia in the perioperative period. Thank you very much for your attention and for your interest in performing these nerve block procedures that can greatly benefit our patients.